people who deal with joint problems, whether it's stiffness, whether it's pain, restricted movement, the problem is people focus on pain so much, right? Because we hear these old things, if it ain't broke, don't fix it. Squeaky wheel gets the grease. So a lot of times people think that with their spine, like if I'm not in pain, then I'm fine. But guys, you have to focus on the motion, not so much the pain, because usually the pain comes at the end of a health problem, not the start. I'm going to repeat that. Pain comes at the end of a health problem, not the start. By the time your hip, okay, imagine your hip joint is in excruciating pain, guess what? You're probably only weeks away from surgery, right? If you're getting that excruciating pain into the groin, it's like you could have, and you see this all the time, right? You probably see it in your friends, like, I woke up one day and my groin was just killing me. I had all kinds of hip pain. I went to the doctor. They said it was bone on bone. I got bone on bone in my knees. I got bone on bone in my hips. What happened? Do you know how long it takes for you to go, quote unquote, bone on bone in a joint? That's decades, guys. That's at least 20 years worth of a problem. Ask the doctor, how long would this usually take? They're like, oh, this has been there most of your life. This has been there for 20, 30 years, 40 years. So then if you take your age, right, again, I'm a very logical person. All right, so if the problem's been there for 40 years and I'm 60 years old, this problem started when I was 20. How do people feel when they're 20? They feel great. They could run through a wall. They feel amazing. Wrong. That's when you're destroying your body the most. Typically, when you're younger, is when we do the dumbest things that injure our body, that set a course of inflammation, of degeneration, and people head down this dark path towards surgery that nobody wants. Nobody really wants. They might want it when they're in excruciating pain, but if you're sitting here listening to me, you don't think you're dealing with a hip issue, you could be in for a rude awakening because, again, by the time you're feeling the pain, there's problems. So what are some other signs that you're going to see way earlier on? Well, I would say let's focus on stiffness because this is another one that people can kind of feel. Being stiff, like getting up, it like takes you a few steps to get moving. You got to like move your back around. You just feel uncomfortable. But once, people say, once I get moving, I'm feeling pretty good. Therefore, it's not a problem. Once I get the cobwebs out, once I get the rust off, once I get on my bike, once I go for a little walk, once I get up out of bed down the stairs, I'm feeling a little better. Okay? Who are you trying to kid here? Who are you trying to fool? Most likely yourself. If you're noticing stiffness like that, there's an issue. Like there's days, and I'll even say right now, I'm a little stiff in my lower back. And that's typical. I typically record the shows on Thursdays. Monday, Tuesday, Wednesday, I'm off. Those are big days, especially Mondays and Wednesdays. Like I can see, upwards of 100 patients on myself. And so that's putting strain on my lower back. I know that. Those are the occupational hazards. But I'm not just going to say, I'm going to ignore, it's because I've been 12 years in practice. It's because I'm a chiropractor. I'm not just going to hang my hat on an excuse. I'm going to say, hey, there's the reality here. It's what I'm doing to myself every day. But guess what? After I'm done my radio show, I'm going to go have a big workout, stretch out. I'm going to work this out so that I'm increasing my flexibility. I get weekly chiropractic adjustments by my wife. I'll be getting one on Friday morning after I'm done with patients. So I have a plan in place to deal with the lifestyle that I'm living. Do you have that plan? Chances are you don't. Not trying to sound high and mighty or mean or anything, but it's just a reality. The vast majority of people, you are ignoring your health, your spinal health, your hip health, your joint health. You're ignoring it. You're either ignoring it or you're medicating it. You're getting up, you're taking an anti-inflammatory, you're taking a turmeric, a curcumin, you're taking Advil, Aleve, Tylenol, you're taking gabapentin, whatever. You are now medicating yourself to the point where you no longer feel this issue or you're trying to lower the inflammation falsely without dealing with the problem. Now, do those things have their place? Does CBD oil or CBD rubs, does magnesium gels, do turmeric? Yeah, they have their place. We have those things at our office for people. They certainly have their place. The issue is people don't use them for their place. They're using them as a treatment. They're using them for something to get rid of the symptom when really you want to use them for something to support your body through an issue.